Hi, my name is Shu, and I hope this next 7-minute video will help you come to a clinical diagnosis of periodontitis with greater confidence and efficiency. I would first like to recognize the latest 2017 classification of periodontal diseases is very comprehensive, but can be clinically confusing. The BSP has streamlined it for clinical practice, which I will be discussing in this presentation. Over the next few slides, I will be distilling the information required to come to a periodontal diagnosis. This will be followed by going through 3 cases to practice identifying the information more effectively. What information do we need? So if we look at the diagnosis statement as cropped from the BSP flowchart in the green box below, there are 5 aspects to fulfill, and the 5 questions listed on this slide are what I filter through to come to a diagnosis more efficiently. Firstly, determining if more than a third of the existing dentition is affected by bone loss. Secondly, what is the greatest interproximal bone loss? The patient's age. Are there pockets of 5 millimeters or more present? And finally, is the patient a smoker, and what is their HbA1c reading? So on this slide, I discuss, or rather show you my thought process. I personally find that the process of elimination an easier way of filtering through the diagnosis pathway. The ratio or the fraction a third is helpful to remember, and this will help us in the first 2 factors to consider. So firstly, generalized periodontitis is more common. So unless there is less than a third of the dentition affected, or there is a distinct molar incisor pattern, this will likely be the diagnosis. Secondly, we will consider the greatest bone loss if that is in the coronal, mid, or apical 1/3 of the tooth. It is also probably worth assigning an approximate percentage of the bone loss at this stage. Should the bone loss be in the coronal third, then you would go on to consider if this is more or less than half of the coronal third, which will help distinguish between stage 1 or 2. Next, I take the percentage assigned and divide it by the patient's age. If this is greater than 1, then it's grade C. If it's less than 0.5, then grade A can be assigned. And if it's neither, then it's B. Finally, are there 5 millimeter or greater sites present? This would be true if you have a BP of 4 present. If patients with treated periodontitis and without pockets of 5 millimeters or greater, then the 10% full mouth bleeding score threshold is used to distinguish between remission and stability. Remission is much more common than stability. It does take a while to become used to identifying this information from a setup of radiographs, but repeated use does help. The following slides will help put this information into context. Please feel free to pause the video to test yourself. So our first patient presents as a 53-year-old fit and well ex-smoker with BPs of 4 across the maxilla and 3s in the mandible. What is the periodontal diagnosis here? I've included the summary of the 5 questions to consider on the right-hand side. So this is a patient with generalized periodontitis stage 4 grade C, currently unstable with no known risk factors. If we answer the questions together, firstly, more than a third of the teeth are affected, so this is a generalized case. The state of greatest bone loss is in the upper left 2, and it appears to be in the apical third at approximately 75%, therefore stage 4. And the same 75% exceeds the patient age, thus grade C. The BP of 4 is telling us that there are sites of 5 millimeters or more, and they are not a current smoker. Therefore, we arrive at the diagnosis, generalized periodontitis, stage 4, grade C, currently unstable with no known risk factors. This is patient number 2, who is a 41-year-old fit and well non-smoker. Again, I've included the questions and the BP on the right. Please feel free to pause to consider your answers if you need more time. Looking at this together, all the teeth seen in the radiograph have associated bone loss, and it's more than a third of the dentition imaged, thus generalized disease. We see that the upper left 7 and lower right 6 seem to both be affected to the same degree of bone loss, just at the threshold of the coronal third, therefore stage 2. The grade is neither more than 1 nor less than 0.5, therefore it is grade B. The BP contains 4s and she has no known risk factors, therefore the diagnosis is generalized periodontitis, stage 2, grade B, currently unstable with no known risk factors. Finally, patient number 3 is a 50-year-old patient who is fit and well and a smoker of 5 a day, having cut down from 20. BPE and questions to consider are again listed on the right. The diagnosis here is generalized periodontitis, stage 4, grade C, currently unstable, with risk factors of smoking 5 a day. The breakdown of the reasoning for this diagnosis is included in the table below. The worst site of bone loss is the upper left one. I hope you found the process and the cases helpful. If you prefer additional support, there is a free app online. I nor Neo are affiliated with this app or their creators, but you might find it helpful in your daily clinical practice. The Android QR code is to the left and Apple on the right. And all that's left for me is to wish you good luck, go forth and diagnose. Thank you very much.